Myanmar are facing decades of discrimination and repression under successful authorities in their country. They are effectively denied citizenship under the 1982 citizenship law, and of course they're also one of the largest statelessness population in the world. In February 2025, the number of children in Rohingya refugee camps in Bangladesh needing emergency treatment for severe acute malnutrition increased by 27% compared to the same period last year. Now let's have more details of that in this report by Marie Camara.
As worsening conditions continue in Rohingya, where people are a stateless ethnic group who predominantly follow Islam and reside in Rakhine State, Myanmar, before the Rohingya genocide in 2017, when over 740,000 fled to Bangladesh, an estimated 1.4 million Rohingya lived in Myanmar in a severe malnutrition. In January 2025, cases of severe acute malnutrition has rose by 25% compared to the same month last year. In February, it became even sharper increase of 27%, marking a dangerous upward trend. The number of children needing emergency treatment for severe acute malnutrition has surged by 27% in February 2025 compared to the same period last year. In Cox's Bazar, where over 1 million Rohingya refugees, including more than 500,000 children, live in the world's largest refugee settlement, families are facing emergency levels of malnutrition. More than 15% of children in the camp are now malnourished, the highest levels recorded since the mass displacement of Rohingya refugees in 2017. The chief of advocacy Unicef, Lily Jane Louise Caproni, stated that the Rohingya refugees are entirely dependent on humanitarian aid, but the severe malnutrition is a threat to their lives, making their living conditions more precarious.
For the 500,000 Rohingya children who live in families who are completely dependent on humanitarian assistance, severe malnutrition is an ongoing threat to their lives. Having fled here from extreme violence starting in 2017, they have nowhere else to go. They have no legal alternative livelihoods. They are entirely dependent on humanitarian aid.
Meanwhile, Nokadia, 25-year-old mother of 14-month-old Mariam, who are said to be suffering from malnutrition, raised concern of how terrified they will be if the agency stop providing for them.
People are saying that these nutrition facilities will shut down. If they shut, we will suffer. We need to feed our children, even we cannot feed ourselves. If these facilities stop providing service, how will we feed our children? If you stop providing us with this terminal food, my child could even die. My child was too weak to eat regular food like rice. She could eat only a tiny amount. I felt so distressed when I knew how sick my child had become after having the terminal food. My child started to get stronger and healthier, and my heart felt more at ease. We feel happy when our children are healthier. Before, she was too weak to eat. She can now eat the terminal food by herself.
The United Nations Children Agency UNICEF has been on the ground in the refugee camps in Bangladesh from day one and continues to render support for every Rohingya refugee child who needs clean water, health care, protection, nutritious food, and education. The agency is also working with the government of Bangladesh and partners. UNICEF is helping provide water and sanitation, including the establishment of diarrheal treatment centers, health services for children and pregnant women, support for access to quality education, including establishing learning centers, reaching children affected by violence, abuse, and neglect with prevention and assistance. At the beginning of 2025, UNICEF estimated that 14,200 children in the Rohingya refugee camps will suffer from severe acute malnutrition in 2025. Declining food rations, poor diets of children, or other factors affecting the supply of the safe water and health services in the camps could cause this number to rise significantly. Marie Camara, Eyeafrica TV News.